Welcome back with a new video of a neuro. In this video I'm going to cover about the spina bifida. Mainly it is a neurodevelopmental disorder. Talking about it, spina bifida, it is a condition that occurs when a spine and a spinal cord do not form properly. It is a neural tube defect. Talking about its anatomy, the neural tube is a structure developing an embryo that later become the baby brain and a spinal cord and tissue that encloses them. Typically, the neural tube forms early in a pregnancy and closes by the 28th day after the conception. In the baby with a spina bifida, a portion of a neural tube does not closes all the way. This affects the spinal cord and the bones of a spine. Here is the figure. As we can see the dimple on the back of a baby, and the protruded part here are the dura mater, spinal cord and spinal fluids. Talking about its causes, the exact cause is not fully understood here, but the expert believe that the combination of a genetic and an environmental factor may interfere with how the neural tube develop in an early pregnancy. Talking about the risk factor of a spina bifida, here does not get the enough folic acid, taking the certain medications like anti-seizure medications, having a condition like diabetes or obesity, having a high fever or a overheat during the early pregnancy. Mainly here are the 4 types, but I am going to cover only 3 types because these 3 are the common. Talking about the first one is spina bifida occulta, second is meningocele, and the third is meningocele. Talking about the first one here, occulta means hidden. Spina bifida occulta is the mildest and the most common type. This type of a spina bifida results in a small separation or a gap in one or more of a bones called vertebra. Many people who have the spina bifida occulta does not know they have it, but it may be confirmed due to the imaging test like X-ray that is done for the another reason. Talking about the second one here is a myelomeningocele. Mainly it is the most serious type here. It is also known as an open spinal bifida. The spinal canal is open, also several vertebrae in a lower and a middle back. Mainly here the part of a spinal bifida, there is a protruded part like a spinal cord protective covering spinal nerves push through their opening at the birth, forming the sac on a baby back. Tissue and nerves are mainly exposed here, due to which the baby is very prone to the dangerous infection. Due to this type, it may cause the loss of a movement in legs and a bladder bowel dysfunctions. Talking about the third type here is a meningocele. It is the rarer type of a spina bifida. In this type, a sag of a spinal fluid bulges through an opening in a spine. No nerves are affected and spinal cord isn't in a fluid sac. Baby with a meningocele may have the minor trouble with the functioning, including with the bladder and the bowels. Here is the figure. We can see the differences here in this type of a spina bifida. There is occulta, meningocele and myelomeningocele. And in this figure above, we can see the gap in a spine, mainly spina bifida. Talking about the symptoms here, it may vary with person to person. Talking about the spina bifida occulta, typically there aren't the symptoms of a spina bifida here, but sometimes we can see the symptoms like the small gap in a spine. You might see the tuft of a hair, a small dimple or a birthmark. Sometimes this mark can be the symptom of a spinal cord issue that can be found with a MRI or the spinal ultrasound in a newborn babies. Second is meningocele. This type mainly affects the bladder and bowel functions. Talking about the third type, myelomeningocele, it is a serious type of a spina bifida. The spinal canal remains open along the several vertebrae in a lower and a middle back. The membrane and a part of a spinal cord or a nerve protrude at the birth, forming a sac. Tissue and nerve usually exposed through sometimes this cover the sac. Baby with the type of a spina bifida may have a trouble with the bladder and a bowel functions, lack of a movement in legs. A baby may have hydrocephalus that can put the pressure on a brain tissue. Now, moving further with the complications. Complications mainly here are difficult walking, hydrocephalus, dyslexia, mainly learning disability, motor skills, memory, or problem solving, paralysis in legs, and scoliosis in later stages. Maybe he can develop. Okay, talking about the treatment option here, mainly surgical options. So, first one is a open fetal surgery during pregnancy. Second is fetoscopy, fetal surgery during pregnancy. And the third is postnatal repair or waiting until after the baby is born to repair the spina bifida defect with a surgery soon after the birth. So, talking about the different conditions, treatment or a surgery. Talking about the hydrocephalus, mainly the surgery is being needed here. Mainly shunting is being done to drain the excess fluid to the another part of our body, usually with the tummy. Second is physiotherapy. Physiotherapy mainly aims to help with the movement, prevent deformity, and stop the leg muscle weakening further, like strengthening the leg, stretching, splinting, or supporting the leg with the daily exercises. Third one is the occupational therapist, which may be carry out everyday activities and become more independent. Mobility aids like wheelchair, braces, splinting, walking aids for the weak leg muscles, treating the bone and the joint problems. Mainly in this we can see the deformity of a foot like club foot, problems like hip dislocation. This type of a surgery is known as a orthopedic surgery in which we can perform in this, treating the bladder problems like incontinence. So here are antibiotics, medicines, and urine catheterization and intermediate urine catheterization or a bladder surgery, treating the bowel problem like particularly the constipation. To treatment mainly are laxative and mainly medicines, anal irrigations, clean out the bowel. This can be done at a home once you have been trained it using the equipment. So here we finishes with the spinal bifida.